Good afternoon. This is Mayor Tom Barrett, and I felt it was important to give you an update on several items this afternoon that I think the people in our community are interested in connection with the COVID-19 crisis. And so I want to start with the first one, which is work that we've been doing, working very closely with Milwaukee County and the Archdiocese of Milwaukee. The issue that we're trying to deal with here is the issue of people with unstable housing right now. Homeless people who are perhaps older, homeless people who might be at risk of catching this disease. And with a lot of congestion in some of our housing shelters, the issue is, what do we do to make sure that these individuals are safe? And what do we do to make sure that they don't infect other people? Fortunately, we've had individuals and institutions that have stepped up to help Milwaukee County, the city of Milwaukee, St. Francis, which has been a strong partner in this as well, to help us deal with this important issue. Specifically, I'm referring to the Archdiocese of Milwaukee, St. Francis de Sales Seminary, which has a location that straddles the Milwaukee-St. Francis border. And on this piece of property, there is a convent that had been occupied through January of this year. But starting in January of this year, this convent has no longer been occupied. So the Archdiocese reached out to our City of Milwaukee Health Department. Our City of Milwaukee Health Department made the connection with them. They, along with the county, went and toured not only this facility, but the Cousins facility to see if either of these facilities would be appropriate to be a house so that individuals, again, older individuals primarily, people who are susceptible to getting COVID-19 or are symptomatic, would have a place for themselves to be safe and to make sure that they were separated from other people so that they would have the social isolation that they need. This location, again, St. Clair's Hall, turns out to be a very good, solid location. So working with the Wisconsin National Guard, working with the Milwaukee County Housing Division, working with our Community Development Block Grant Office, along with our Health Department, we have been able to work very, very closely, and we're just ironing out the final details, which with the Archdiocese right now, that would allow us to have essentially two wings, one for people who are susceptible and one for people who are symptomatic. This would allow us, again, to provide them with safety and to provide the social isolation that's necessary for our community. And the reason that this is a good site, and I don't know how many people have been to this site, is to the east of it is Lake Michigan. There are not many homes in this area, and it will allow us to work very, very closely in a collaborative effort. So I want to give a huge shout out to County Executive Abley and his staff. I want to give a huge shout out. Our health department, our community development block grant office has spent literally hundreds of hours over the last few days preparing this site. In addition, we have gotten donations from the United Way. We've gotten donations from a number of local hotels, and Steve Mahan, who I think may be joining us on this call, can go through those hotels that have stepped forward so that this location will be up and running, hopefully as soon as this week. So let me stop there and turn it over to Steve to talk a little bit about what he has done and how closely he's worked with the county and the state to make this a reality. Steve?
Thank you, Mayor. This has really been a collaborative effort throughout the county. We sincerely want to just back up to what Mayor Tom Barrett said, thanking the city of St. Francis for being so open to making this happen. And the Archdiocese, of course. But this has been a very large collaborative effort from the city and the county. Also, the city of Milwaukee and Milwaukee County Continuum of Care of Shelter Network that has been very active. The donations received to date have been very gracious, from the Plaza Hotel in the city of Milwaukee, the Ingleside Hotel in Pewaukee, Homewood Suites, and a number of Marriott hotels have provided linens, multiple linens, a lot of disposable goods such as paper goods, and the Milwaukee Continuum of Care has also stepped up to make sure that this site is fortified with everything it needs to be sustainable moving forward. And we're very thankful.
And Steve, again, thank you for your work. Steve's put a lot of hours just in the last few days on that issue. So again, the purpose here is to provide some housing stability as well as social isolation to individuals who are very vulnerable in their lives right now. We know that there's a lot of people who have lost their jobs. We know that there are a lot of people who have underlying health conditions who are susceptible and need a place to stay. So this takes a lot of the burden off our shelters, and at the same time, I think does so in a way that's very responsible. So a huge shout out to the Archdiocese, a huge shout out to everyone who's been involved in making this a reality. The second issue that I want to talk about just briefly is we continue to see numbers grow here in Milwaukee County. The numbers just have come out in the last hour. We're over 609, I think 609 is the count I saw for Milwaukee County. For the city of Milwaukee, it's 478. So we're continuing to see cases throughout the county, but a disproportionate impact in the city, particularly on the northern part of the city. And it's hitting a lot of neighborhoods on the northern part of the city very, very hard. So we want to stress, as we always have, how important it is to keep that social isolation, that social distancing. This is spread from individual to individual through droplets in the air. So sneezing or close contact is what is allowing this to move so quickly through our community. So we're going to keep hammering home on that theme of please follow the stay-at-home order, the stay safer at home order. This is in place for your safety. This is in place to make sure that we can get through this and get life back to normal as quickly as we can. I want to talk a little bit about what's going on in Washington. We've had a lot of contact with Congresswoman Moore in her office. I talked to Senator Baldwin yesterday, and we know that there are resources that are coming from Washington. I earlier today had a meeting with key members of my staff, with my budget office, with my Department of City Development, with my health commissioner, to make sure that we are going to, as quickly as we can, working in conjunction with the county and working in conjunction with the state of Wisconsin, get these resources out into the community as quickly as we can. And we know that there are two pressing areas right off the bat that we have to deal with. The first, of course, is the healthcare one, which is by far the biggest immediate concern that we have right now, to do everything we can to stem the spreading of this disease. That means putting more effort and more resources into tracing. That means doing everything we can to identify those individuals who have tested positive and ensure that they are isolated, again, for their own sake and for the sake of their family members and the greater community. But we want to do that, again, in conjunction with the county and the state, so that there's not a duplicative effort, that we're adding to each other's efforts to do that. In addition to the money that's going to come through the main bill, there's going to be a significant amount of money that's going to come to Milwaukee through the Community Development Block Grant Office. And again, Steve Mahan, who is on the phone with us or on the screen just minutes ago, is a person who is involved there. We know housing needs are going to be very, very important. And that's something that we are working to make sure that people don't lose their housing. Of course, the moratorium is now in place against evictions and foreclosures. I think that that's a solid step in the near term, because we don't want people to lose their homes during this period. Part of our conversation earlier today was with Rocky Marcoux from our Department of City Development, and we are going to be working later this week, reaching out to financial institutions to see how we can be working with them to make sure that they're not calling in loans, to make sure that the bridge loans are there if necessary, to see what we can do to make sure that businesses don't suffer. We know that this is an incredibly challenging time in terms of the unbelievable increase in unemployment claims. We know what a pressure is placing on all types of businesses. So again, working with our state allies, working with our county allies, we're going to do everything we can to ensure that that doesn't become an even greater problem than it is. But I am not minimizing that problem. Right now, we're facing two really challenging situations. Obviously, the unprecedented healthcare challenges that we have not seen in decades, probably going back to 1918 in this community or in this country. And in addition to that, the economic hardships that are being caused as well. The final issue that I want to touch on is the issue of voting. As you may recall, we've had challenges this week as the number of people who have in the past, very, very, very reliable poll workers have literally at times, sometimes dozens by the hour, dropped out of coming back to us. And this includes our chief inspectors. The chief inspectors are the individuals when you walk in to vote. Those are the people that are running the site. And we've lost a high number of chief inspectors who don't feel that it would be safe for them to work. That has caused us a huge problem. And that is why I contacted the legislative leaders, why I contacted the governor to say that I felt that we needed to have this election be a voting by mail election, that the balloting should be done by mail. I was very pleased to see Governor Evers is taking a leadership role in recognizing the difficulty that we face here. But I want to put this in a context. Right now, if an individual tests positive for the COVID-19 virus on April 3rd, April 4th, April 5th, April 6th, April 7th, my understanding is the only way they could vote, because that's after the time to request an absentee ballot, would to go vote in person. I hope I'm wrong on that, but that's my understanding of the law right now. We do not want, and that could be dozens, if not hundreds of people who are going to be testing positive, again, on the 2nd, the 3rd, the 4th, the 5th, the 6th, I'm sorry, the 3rd, the 4th, the 5th, the 6th, and the 7th, that 5-day period. We don't, for their own sake, and for the sake of the poll workers, and for the sake of other voters, we don't want them to have to go vote in the polls. We're looking for a way to safeguard their right to vote in our democracy, but not to put them at risk, and not to put our poll workers at risk, and not to put other members of the public at risk. I think it's worth noting that just yesterday, the governor of New York, Governor Cuomo, has delayed their primary through the end of June. Why is this significant? This is significant because his decision actually puts his primary after the date for which delegates for the Democratic convention are chosen. In other words, he is willing to give up his political clout for his state, in part because of this health crisis. I'm trying to look and have my staff look right now, but I don't know that there is any other state other than Wisconsin, and this is something I invite all of you to look at and help me figure this out. I don't know that there's any other state in the next month or month and a half that is planning on having in-person voting on election day. I think state after state after state has recognized just what a serious public health challenge it would be to have in-person voting on election day during the next month. And that's why, I appreciate the governor's leadership on this. That's why I'm calling on the state legislators to look at the leadership that we've seen in virtually every other state, Democratic and Republican, to act on this matter. So with that, if there's any questions, I'm happy to answer any questions.
Jeremy Janine from Urban Milwaukee is asking the number of beds in the facility.
My understanding is that there's 90 beds, that there's 2 wings. So my understanding, again, and this is subject to change, that you'd have one wing for people who are symptomatic and another wing for people who are at risk. And there will be security there, security cameras there to make sure that, and obviously the City of Milwaukee Health Department will be the entity that is making the referrals to individuals to be located there. It's temporary. We hope it's very temporary, but it's defined temporary housing for people who are very vulnerable and who are at risk right now.
Question from the Spanish Journal.
I'll read it here. There will be access to health and free testing in clinics and hospitals for members of the public with no health insurance, and also for undocumented. Also, if there will be any economic relief locally for undocumented facing a challenging situation. I've been working and I have had several meetings over the last several weeks with the leaders of not only the hospital systems, but our community health centers as well. I think for many individuals in our community, the federally qualified health centers are the ones that many of our residents turn to. And so we want to make sure that we're reaching their needs. So we're working with them, and we're going to continue to work with them to make sure that there is testing. I want to be careful on the testing, though, because this is an issue, and I think it's important we have this conversation. When I first brought this up, not only to our hospitals, but to our FQHCs, my goal was to have some sort of drive-up testing or drive-through testing. And at the second meeting is when I learned that we had these huge problems in getting not only the testing equipment, the tests themselves, but the PPE. And that was a backlog that began in February. We still have some issues there. There is more testing that's occurring, but it is going to be primarily for people who are symptomatic, is my understanding. And that means making sure that we are using these scarce resources for those who are showing symptoms. it is my intention and my hope and my goal that we get a lot more testing equipment, that we get a lot more tests themselves, because as I've looked at Singapore and Hong Kong and South Korea, I think a major way for us to really start attacking this problem is to be able to do more extensive testing. Because by having more extensive testing, once we get through this part, we'll be able to isolate the individuals who are testing positive in the hopes that those others in our society can get back to work. We have to also work to get others back to work. But I believe that people will not be charged for this, and that's certainly our intent. I believe the federal legislation ensures that they are not charged, but we will double check that. The question is, any more clarity on what the CDC officials on the ground in Milwaukee are studying? I think that the CDC officials first came to Milwaukee when there was a concern about exposure at Children's Hospital. That's what brought them here. I think that then you had the events up in Grafton with the long-term facility there, and the concentration that you're seeing in Milwaukee right now, particularly on the north side. So it's my belief that that's what brought them here. That's why they're still here. But I'll have the commissioner. The commissioner's not joining me today, but I'll have her address that as well. But that's my understanding as to what brought them here and why they may still be here. I don't know for certain whether they're still here. Is COVID-19 testing happening on weekends in Milwaukee County? And again, I think certainly for those who are symptomatic, who are presenting themselves, my understanding is yes, it is. I talked to the head of our lab, and they are testing all weekend. He was talking about our personnel for the health department are literally working around the clock to make sure, and we are concerned. We're concerned about our employees and the toll it's taking. I know this is taking a toll on healthcare employees throughout this nation, and I think we should all be very mindful of that and thankful for not only the work they're doing, but the sacrifices they're making for us. So yes, the testing is continuing through the weekend. Can we get an update about what all needs to be done at this hall to make it safe before people can be brought to Clare Hall? Steve, are you still on the phone? Do you want to address that? I don't know if Steve is still with us. Steve, I'll repeat this for you. What all needs to be done at this hall to make it safe before people can be brought to Clare Hall? Maybe you want to talk about the work that you've already done there.
As far as all the referrals coming to this facility are from the health department working with the shelters in the continuum of care. So there's over 14 shelters that are able to refer individuals who are symptomatic or that have a high risk. So I guess I'm trying to see what exactly that would entail as far as additionally, they would be there until such a time that they could either be permanently housed or referred for additional medical care.
The follow-up question, is there any concern of having people who may be sick in one location? Is there a concern of creating a hotspot within Clare Hall? Again, our belief is that this will be isolation. This will be isolation. So I do not believe that there will be a concern about a hotspot. We are going to be looking for other locations as well. We are very concerned about a surge in our hospital system and the adequacy for the number of beds, not necessarily today. And I will be working this week with hospital leaders as well as healthcare community leaders to see what their projections are and how we can better coordinate as a community the ICU beds, the regular beds, because there may, and you've seen this around the country, there may be a need to have other locations outside of our current hospitals for people who are not at risk to be in the hospital, but still are symptomatic. But it is our belief that by locating different locations, and again, we are working to get different locations around the community, that we'll be able to address this in a way that's equitable to everyone. And then the final question, is it 90 beds total or 90 in each wing? My understanding, and Steve, you can correct me, it's 90 beds total, is that correct? Steve seems to be frozen right now. That's my understanding. We'll let you know if that's different. All right, I want to thank everybody, and we'll get you more information. Again, the final documents have not been signed between the city attorney and the archdiocese, but they are working on it. And I want to thank the archdiocese again. I want to thank Milwaukee County. I want to thank Steve and his staff, our health department. I want to thank St. Francis. Everybody here is stepping up in a way that our community can be proud of. These are individuals, again, who have unstable homes right now. And I think as a society, we have an obligation to do what we can to make sure that they are not only in a place where they're not exposing others to COVID-19, but are in a position where they do not get COVID-19 if they are, again, in one of the high risk categories. So we want to continue to do this in a very humane way, being sensitive to neighborhoods, being sensitive to communities, and doing it in a way that we can all say we're trying our hardest to deal with this unprecedented challenge. Thank you very much.